The following is a sponsored program paid for by Yaba TV.
Welcome to our beautiful show, the Yaba TV show. I am your host, Sia. Today we have two medical doctors on the show, Dr. Kadran Gill and Dr. Jerry Abraham. Both of them are very well experienced with several years of experience practicing as a medical doctor. We are going to talk about the pandemic. We are going to talk about how important it is to be vaccinated. We are going to talk about the different variances, who is protected and who is not, and why. So there's so much to share with you today. So in case you don't have a medical doctor or you have a need to connect with a medical doctor, this is definitely the show to watch. So tell everybody you know about our beautiful show, the Yaba TV show. We'll be back in a moment. You are back with our lovely show, the Yaba TV show. My name is Sia, your host. The concept of our show is to bridge the cultural divide between Africans and African Americans based on first-hand knowledge. And today is one of the best shows that we have to present to you at Black History. Happy Black History Month. My guests on today's show is Dr. Kadran Gill and Dr. Jerry Abraham. Both of them are medical doctors, and they're actually doing so much in the community, especially at this pandemic. During this pandemic time, they're helping so many people. So, but before I go any further, let me actually get the formalities out of the way so I can introduce my guests on the show. Both of you, welcome to the show.
Thank you.
I'll start with you, Dr. Kadran Gill. You're not a stranger on our show. So many people have known you before on the radio show and now on the television show. But for those that don't know you, tell us a little bit about yourself, please.
Thank you, Sia, for inviting me to this very spectacular show today. And my name is Kadran Gill, and I was born in the Caribbean, as you realize. I left there as a youngster, and I came to New York City, 1965. I attended Columbia University for my undergraduate education, and then I went to Rutgers across the river, Hudson River, to do my medical school there. Then, as the saying goes, go west, young man. So I left the east and I traveled to California. Did my residency at Martin Luther King Hospital, did a fellowship in family practice, and I spent about 9 months traveling the world. I spent 3 months in Africa, 3 months in Asia, 3 months in Europe, and then I came back and established my practice on Vernon and Broadway. Now we are acting on Broadway.
All right. Dr. Jerry Abraham has actually traveled to some part of Africa as well, correct?
Correct.
Yes. Tell us a little bit about that.
Yes. Well,
and about yourself. Yes,
thank you for having me.
Yes.
Dr. Jerry Abraham, I'm the director of Kedron Vaccines in South Los Angeles. I did have the opportunity to work in many parts of Africa on 3 different deployments. We were in East, West, and in South Africa, working on preventing injuries, working with the World Health Organization and the World Bank. And so we had the opportunity to really understand the health systems in many of the countries in sub-Saharan Africa and find ways to improve their capacity and their technical abilities, especially when it came to data collection for public health and medicine. And with that improved information, you can make enhanced health policies that can keep people safe and healthy, and in this case, prevent car accidents, gun violence, suicides, all of the things that are plaguing us here in the United States, same things plaguing people in Africa as well. That's what we do, but when COVID hit, I picked up the phone and I said, where are our vaccines? And that was on December 23rd in 2020, and here we are now, over a year later, hundreds of thousands vaccinated, hundreds of thousands tested, and we're still dealing with COVID, and so we'll keep up the fight until we win against this pandemic.
I like that spirit. We'll keep up the fight until we win. Talking about this pandemic, I know there's a new variant, this Omicron. Am I saying it correctly?
Yes, the Omicron.
Yeah, let's talk about that. How do people get infected? And for those who are already vaccinated, are they safe?
The vaccines are holding up very well. So the best thing that we can do is to continue all the things that we've been doing, especially making sure we get our vaccines, including the booster shots. Everyone over 12 years old now can get a third shot booster. Everyone over 5 years old needs to be vaccinated. But really our best strategy is continuing to maintain good social distancing, wearing our masks, good hand hygiene, and most importantly, making sure that we get vaccinated. But we are monitoring the situation because with as infectious as Omicron is, there is room for new mutations, new strains, new variants, and with that comes the risk that our vaccines may not continue to protect us as best as they should or can. So we're really looking to the manufacturers to improve our vaccines, create better vaccines, and in the meantime, we need to make sure that we do everything we can to stop the spread of Omicron.
Wow, serious. Dr. Gill, from my understanding, you do administer the vaccine at your clinic, correct?
Yes. And I want to echo what Dr. Ibrahim said in reference to ending this pandemic. Get vaccinated. Okay. So at my clinic, I do administer the Pfizer vaccine for children and adults.
Okay.
And the response has been very, very good. We have a lot of people. We have special days when we administer the vaccine, Wednesdays and Fridays. Call and make an appointment, and we will fit you in as best we can.
So I know there is protection from ages 5 to 11 children, but what about under 5? What's going on?
Yeah, the best way that we can protect those most vulnerable, and that includes the people under 5 years old, and those that may be older, those that may be sicker. There are people, because of their chemotherapy, may not be eligible for vaccines or even certain treatments. So we really all need to do our part and hold one another accountable to protect the most vulnerable, including our children. And the way we do that is continuing to maintain all of these public health practices, including getting vaccinated. But there are currently clinical trials in the United States for 2-year-old to 5-year-olds and 2-month-old all the way up until 2 years old. So eventually we will have vaccines. But what I'll remind your viewers are we get vaccinated for many things throughout our whole life. From the moment we're born until we die, we get the measles, mumps, rubella vaccine to go to school.
Yes.
We prevent cervical cancer with the HPV vaccine. We protect our elders with the flu vaccine and the pneumonia vaccine. I don't want anyone to think about these vaccines any different than that. These are tools that help us live our best life, our highest quality life, our longest life. Why wouldn't you take that shot?
Wow. That's a question that goes to our people, particularly African Americans and some Africans. Some, not all, they refuse to take the vaccine. And they're saying, they accuse me, why are you poisoning the minds of people to want to take the vaccine because you have an outlet to disseminate information? That's what they say. What's your take on that?
Well, my take on that, I think Dr. Ibrahim said it quite well, eloquently. I think there's a challenge with the social media. The social media is a double-edged sword. It's a source for knowledge and nonsense.
What a combination, knowledge and nonsense.
So my message is to get vaccinated as soon as possible. And as soon as everyone becomes vaccinated, we will be no longer hostages to our fellow Americans. The way I look at it, that we have been held hostage by our fellow Americans who are unwilling to become vaccinated. So,
Yeah, and I'll tell you right now, we see people with COVID. Right now, you cannot get a bed in the hospital. You will wait in the emergency room 4 days. When we have to give you very serious medicines in the hospital, I don't see people asking me what's in that medicine, what's in that ventilator or ICU. So they take all those treatments, even though those are much more deadly and riskier treatments that we offer. So you're gambling with your life when we have medicines that work. In the United States, they are free to everyone.
So I'm gonna come back to you on that. Sure. We're gonna talk on that and more. There is a lady that sent me a text just before I came for production today. She has a lump in her breast, and she's worried about taking the vaccine if that's going to affect her. So we're going to talk on that, but let's acknowledge our sponsors first, the people that make this show possible. Be back in a moment. You are back with our lovely show, the Yaba TV show. I am your host, Sia. With me today is Dr. Kadran Gill and Dr. Jerry Abraham. Both of them are medical doctors in the South Los Angeles area. And of course, they've traveled to different parts of the world, including Africa. So we were talking about a woman that has a lump in her breast. She sent me a text before I came for production today. She wants to know, how is the vaccine going to affect her if she decides to take the vaccine?
Sure, I can start with answering that, and then Dr. Gill, if you want to add to that. I'll just start by saying, yes, there have been some concerns that after vaccines, people sometimes feel some lumps under their arms or maybe even in their breast. And for that reason, we ask that people do not get their mammogram immediately after the vaccine, just to make sure we don't have any false results or anything that could be incidentally found. Because your body is reacting to the vaccine, you're going to have antibodies being produced, and perhaps you may feel or find swellings, particularly in the tissue where our immune cells accumulate, where antibodies accumulate, and those are lymph nodes. So when we talk about breast cancer, we're really looking for lumps in the breast tissue and also sometimes in the lymph nodes around the breast. And so for those reasons, we ask people to delay that mammogram just a little bit, but we definitely understand people's concerns. Are these vaccines safe? Can they make me sick? Can they make my condition worse, especially if you're already at risk for ovarian cancer or breast cancer? So that's why we really think it's important that you continue to talk to your medical team, your physician, and make sure you understand all of the implications, and then together make a shared decision to go get vaccinated. But just remember, this vaccine has now been given to billions of people across the planet. We have more information about the COVID-19 vaccines than any other medication in human history.
But you said that that patient had a lump in her breast.
Yes.
And it has not been evaluated, and she's concerned about getting the vaccine. Well, I think, as Dr. Abraham said, that she should get that evaluated and see what the problem is.
But what can be even more frightening is if we lose time in this battle against cancer, and we don't want to lose that time, and that's why it's so important you go and get that checked out.
Despite the fact that the virus is less lethal but more contagious, the people that goes to the hospital are filling up the hospitals, and the personnel that we have are unable to take care of patients with heart attacks, pneumonia, and all of the traditional diseases because of the beds that are being filled up by the people who are sick with the COVID-19.
So I had a couple also that contacted me today. The husband had COVID before, he recovered, but he still has symptoms. He tested negative now, but he has cold in his chest and he's coughing and he has some pain sometimes. And the wife is concerned that the COVID has not completely gone, but when they do go to test, it tests negative, but he still has a COVID symptom going on. What's going on here?
There's a syndrome called a long COVID syndrome that has, after you get sick with the virus, because the virus attacks all parts of the body, lungs, kidneys, the heart, etc., etc. So there's this syndrome, long COVID syndrome, and you get problems after, despite the fact that you're negative, you will have symptoms that may last or may go over with time.
But
so that's
does that mean if you come in contact with people, you're going to infect them? Are they going to get the virus?
This is an important question because not all testing is the same also. So it's very important that right now, while there are a lot of scams out there, be careful about where you are going to get your test. Make sure they're FDA approved, emergency use authorized. There is the rapid test that you should get the results within 10 to 15 minutes.
COVID-19 has not been so rampant in Africa compared to how it's been rampant here and how many people died here in the United States. But that doesn't mean that Africans should not take precaution. That doesn't mean that they should not take a vaccine. We all need to take vaccine. But my bottom line story to this is America is a superpower country. As America goes spiritually, so goes the rest of the world. So if Americans, we can all take vaccine, the rest of the world will follow our footstep. But if we are fighting to take the vaccine, people are going to imitate the same thing. Correct me if I'm wrong.
That's right. We set the pace of the world.
And there may be lots of explanations for why we may not see the high rates in Africa. They may not be testing at the same rates, and also they may have different, if somebody dies, we may not always know if they died having COVID or not.
Well said. Great message. Oh my goodness. I wish we had more time because these two doctors, they're very, very knowledgeable about medicine and you. Because if you have complications, they do have the answers. So don't delay. Those who have not taken the vaccine, please think about it. It's time, it's time, it's time. We have to change our world. And the only way we can change it is beginning with ourselves, our individual families, then our communities at large. But I do want to thank both of you for taking the time out of your busy schedule to come to our show, to express what you know about health and wellness today, and particularly about what we're going through right now with this pandemic. I do appreciate you, and I thank you for your practice in our community. I thank you for your benevolence as well. Well said. This has been a heavy-duty show today, but we need to take you to music land. First, we're going to acknowledge our sponsors, and we're going to bring a little music video to gladden your heart. Maybe that will make you want to jump up your seat and say, you know what, let me go take the vaccine. The doctors have talked to me. Now I enjoyed myself. Let me go take the vaccine. Anyway, on a serious note, it is important to go take the vaccine. Think about it. Lives can be saved. Your life can be one of them that can be saved. Trust me, it is important. Go get it. But enjoy the music video. Even as we take you to music land, I'm still singing it, I'm saying it, I'm screaming it. Go take the vaccine, but enjoy the music. Be back in a moment. Thank you so much for taking the time to watch our television broadcast today. We are on every Sunday at 4 p.m. right here on KCAR 9. Today we have two medical doctors that gave you their expert opinion about what's going on, medicine, and you, and why you should be vaccinated. I hope Yaba TV was able to bring you information that can help you and your family. Tell everybody you know about our beautiful show. We are on every Sunday at 4 p.m. like I mentioned earlier. But we do have a YouTube channel. Take the time to go to our YouTube channel. Send me a dialogue. I take time to read those notes that you send to me at the YouTube channel. But I suggest one thing. Share, subscribe, and like. I'll say it again. Like, share, and subscribe. That's the only way we know that you're liking what we bring to you. We also have an Instagram page, Yaba TV. Follow us on Instagram. Till then, we will see you next week at the same time on the Yaba TV show, your contemporary bridge to the motherland, Africa.
The proceeding was a sponsored program paid for by Yaba TV.